Examination of the newborn baby includes examination at birth, at 24 hours, at discharge and at follow-up. Newborn baby at birth is examined following the principles of assess, classify and advise. In assess, we examine the newborn baby following the principles of look, listen and feel. It is very important to wash the hands thoroughly before and after examining a newborn baby. It is important to look for major malformation in the baby. The baby should be examined from the head to the toe. The back of the baby should always be examined. Then examine the oral cavity. Look for other malformations which may have a systemic association. A baby with a single umbilical artery should be screened for associated vertebral, anorectal, tracheoesophageal and renal malformations. The presence of a single transverse Palmer crease suggests the presence of trisomy 21 or Down's syndrome. Look for other dysmorphic features, for example, low set ears, depressed nasal bridge or other abnormalities. A newborn baby may have asymmetric cry due to absence of depressor anguli oris muscle. Look at the spine and the limbs. Look for any abnormal swelling. Look and record the breathing rate, breathing pattern, color and heart rate. The respiratory rate should be counted for full 1 minute with the help of a watch kept bedside. It is very important to differentiate between a normal breathing in a baby and chest indrawing. Look at the general activity of the baby. After looking at the baby, the examiner listens for the cry. He listens for grunt and heart sounds. The last step in the examination is to feel. The examiner feels for any abnormal swelling, which could be a caput. Caput is a collection of fluid in the subcutaneous space. Other abnormal swelling could be a cephal hematoma. This baby has a caput. It is spitting and is crossing the midline. Now palpate for the femoral pulses. Now feel for the capillary fill time. Press the thumb for 5 seconds over the skin of the sternum and see for refill. Normal capillary fill time is less than 3 seconds. Palpate the abdomen when the infant is not crying to feel for palpable liver, spleen or any other abnormal swelling. Do not forget to palpate for testes in a male baby. Lastly, it is very important to document the records on a sheet of paper for future note and reference. The aim of this examination is to pick up malformations which may have been missed in the previous examination and to look at breastfeeding. Look at the posture of this baby. The normal resting posture of a term newborn baby includes loosely clenched fists, flexed arms, hips and knees. In small babies, the limbs may be extended. Babies born in breech position may have fully flexed hips and knees. The feet and legs may even reach near the mouth. Look at the color of the baby. Is the baby pink? The color of the baby should be assessed from the oral mucosa and the tongue. Peripheral bluish discoloration of the limbs may persist for the first few hours and may be normal. This is known as acrocyanosis. Look at the skin of the baby. The skin may be dry and peeling may be present in a post-term baby for the first few days. Watch for any discharge from the eyes or umbilicus or any redness around the umbilicus. Redness or discharge from the umbilicus should be noted with caution and treated appropriately. Inform the mother that the umbilical stump will fall off in 5 to 7 days. She should not touch, bandage or put anything on the stump. Count the respiratory rate and watch for any retractions. Look for any abnormal swelling of the scalp. It is very important at this point to look for abnormality of the limbs, fingers and the back, as they may have been missed in the initial examination. Feel for any evidence of hip dislocation. For this, stabilize the pelvis with one hand and examine only one side at a given time. Place your hand on one side with the thumb on the medial aspect and the middle finger on the bony prominence over the lateral aspect of the hip. Feel for the lateral displacement of the femoral head as you move the thumb laterally. Examine the weight and the temperature. It is very important to look at the feeding behavior of the baby at this time. Look at this baby. This baby is well positioned because head is in line with the body, the whole body is well supported, baby is turned towards the mother and baby's abdomen touches the mother's abdomen. This baby is also well attached. The mouth is wide open, the lower lip is everted, little areola is visible below than above and chin is touching the mother's breast. The next step is examination of the baby with the principle of listen. Listen for grunt, cry and auscultate the heart for any murmur. The next step is examination of the baby with the principle of feel. Feel for femoral pulses and capillary fill time. Feel for cold stress and the temperature with the back of the hand. The presence of yellowish discoloration of the skin seen after blanching the skin over the firm surface is indicative of jaundice. Confirm all the findings of inspection. Again, note all the findings on a sheet of paper for future note and reference. The examination includes asking the mother about breastfeeding and general activity of the baby. The mother should be asked about any problems she is having. The next step includes examination of the baby following the same principles of look, listen and feel, with special stress on feeding, icterus and follow-up advice if the mother has reported no problems. It is important that the mother is counseled about the danger signs when she has to seek immediate referral. The danger signs in a newborn baby are when the baby has poor feeding or stops feeding, fast breathing, grunting, severe chest indrawing, abnormal movements in the form of convulsions, swollen eyes and draining pus, umbilicus, draining pus and redness extending to the skin, swelling, redness and hardness of the skin, bleeding from the stump, excessive pallor, yellow skin on the face when the baby is less than 24 hours old, or yellow palms and soles. Look at this baby. Is the baby icteric? Note the icterus separately on the record sheet. Do not forget to auscultate the heart for any abnormality, including the presence of a murmur. It is very important that the above findings are recorded on a separate sheet. The examination at follow-up includes asking the mother about breastfeeding and general activity of the baby. The mother should be asked about any problems she is having. The next step includes examination of the baby following the same principles of look, listen and feel, with special stress on feeding, icterus and follow-up advice if the mother has reported no problems. It is very important to weigh and record the head circumference of the baby for the following reasons. It provides a baseline and is a part of growth monitoring. It indicates that the baby is receiving adequate nutrition. It defines low birth weight babies who are at risk. It helps to calculate drug dosages. It helps to monitor response to treatment. In addition, it identifies the babies who have an underlying condition and need examination and treatment. Do not forget to auscultate the heart for any abnormality, including the presence of a murmur. Mothers should be counseled about the importance of breastfeeding. In addition, she should be told about the immunization and the next follow-up visit. It is very important to document the records on a sheet of paper for future note and reference. Thus, a systematic, sequential and careful examination of a newborn baby helps us in early identification of congenital malformations and the level of sickness, thus guiding us for timely intervention and appropriate management.